We all get symptoms in our life. We know that pain, a rash, a fever are signs that something is wrong. But how do we treat patients that come to us with numbness, weakness, weird feelings, pain, loss of function?
To treat a problem, we must know the cause of the problem. The wrong diagnosis and treatment can not only prolong the patient's suffering, worry, and disability, but it can also be costly and even dangerous to our patients. There are the usual tests that can be done, all of the x-rays, the MRIs, and the blood tests. But what if all of those tests come back normal and we don't have enough information to provide a good diagnosis? In many cases, there is a quick, easy, and reliable test that helps us to pinpoint the cause of the patient's problem and begin proper, effective treatment.
I had some numbness and tingling in my hand. I couldn't feel anything, and even when I pushed the buttons, I was like, oh my God. And did I have a stroke? I was so scared because I remembered what happened to my uncle when I was growing up.
I kept seeing these commercials for vascular diseases, but I know the drug companies put these things out there to scare people. I worry about my diabetes. How can I find out what is wrong with me?
Electromyography and nerve conduction studies provide your doctor with valuable information about the integrity of your nerves and muscles. This test can help your doctor reach the correct diagnosis and achieve the appropriate management or treatment for your condition.
During a nerve conduction test, small flexible electrodes are placed on the skin of the hands or feet, and the machine delivers a gentle electrical impulse near the area of the nerve. This stimulates the electrical impulses generated by your nervous system. This impulse produces a visual signal on a computer monitor, and when analyzed, it can provide information about the condition of the nerve. During an electromyography study, a very small pin is inserted in the muscle that helps us evaluate the condition of your muscles. EMG NCV is an easy, reliable, and safe test.
My doctor sent me for an ultrasound, and he had me do some physical therapy, and he had me even modify the activities. It took some time, but it's really working. I was so glad that it was just carpal tunnel. I knew all these years working on computers, it would catch up to me.
The doctor explained to me that the feeling in my legs is a pinched nerve. I am so glad that it hasn't affected my diabetes. I have worked so hard on keeping those numbers down.
Listening to my patient's problem, obtaining a good history, and performing a careful physical examination are extremely important for getting the correct diagnosis. Adding the nerve studies helps me to confirm my diagnosis and get to the root of the problem quickly. This helps me to help my patients quickly and effectively.
These are but a few of the cases where the astute physician, through their concern, learning, and experience, can guide the patient in the right direction toward a correct, timely diagnosis and start the right treatment plan.
I felt really comfortable about the tests, and they explained everything to me, and I was really happy that they took their time at it.
When my doctor asked me to do this test, I wasn't sure what to expect, but it was easy, it was painless. And the staff was great and very professional.
Dr. Kostopoulos is board certified in clinical electrophysiology testing, has over 15 years experience in clinical electrophysiology, and has numerous publications. Our team of trained professionals, always in the closest cooperation and communication with the patient and the ordering physician, is here to provide you with a pleasant and comfortable experience and to obtain the valuable information needed by your doctor.
Proper testing can assist in correct diagnosis that leads to appropriate treatment. EMG and CV testing can be part of your health solution.